Welcome all. I'm Rita Riker, President of Focus Greater Syracuse, and so pleased to see so many people here today. Today, we're very pleased to welcome Megan Stuart, Director of the Housing and Homeless Coalition. She'll share how the coalition operates and how it's structured. She's going to report on the state of homelessness in our community and talk a little bit about what we can do to meet the challenge of homelessness and housing insecurity. First, a little bit more about Megan and the Housing and Homeless Coalition. As I mentioned, Megan is the director of the Housing and Homeless Coalition of Central New York, which acts as HUD's continuum of care for homelessness for Onondaga, Cayuga, and Oswego counties. The coalition's mission is to assess community needs and foster collaboration to prevent, reduce, and ultimately end homelessness, excuse me. She has been serving as director since June of 2018 and has worked in housing and homelessness for over 15 years, overseeing federal, state, and locally funded projects. Megan holds a bachelor's degree from William Smith College. By the way, I am also alumna of William Smith College, and an executive master's in public administration from Syracuse University. She holds positions on the local emergency food and shelter program board and the CNY Regional Healthcare Equity Task Force. Megan, it's all yours.
Thank you, Rita. Thank you for having me today. I'll just pull up my presentation and get going. So today I'd like to talk a little bit about the homelessness crisis in Central New York and how the coalition is meeting the rising challenges that we're facing as a community. First, I want to talk about who is the Housing and Homeless Coalition, and Rita just gave us a little bit of an introduction. But we're a collaborative of nearly 40 member organizations working to end homelessness in Central New York. As Rita mentioned, we cover 3 counties, Cayuga, Onondaga, and Oswego. Our coalition was actually born out of the city of Syracuse's mayor's task force to end homelessness that was formed in the 1980s. I believe it was 1987. So we have deep roots in the community working to address this issue. In 2012 is really when the coalition took the form it's in now, with Housing and Urban Development, or HUD, at the federal government required communities to create a formal structure on how they were going to respond to homelessness at a local level. That form became known as the continuum of care, and really were responsible for overseeing the homelessness response system. And I'll get into a little bit more of what that means and exactly what is a homelessness response system. First, I want to give you a look at our member organizations. Now, this isn't a comprehensive list of everyone that works with the coalition or is involved with the coalition. These are our voting members who really dictate the work of the coalition and its strategies moving forward. So you can see here, it is a combination of local governmental organizations, nonprofits, there's community groups involved. So really running across all of our stakeholders in the community coming together to do this work. Our mission, as Rita mentioned, is to assess community needs and develop a comprehensive strategy to reduce, prevent, and ultimately end homelessness and housing vulnerability in Central New York. Our vision for this community is really simple. It's a place where everyone has a safe, permanent place to call home. For anyone on the call who's heard me speak before, you know I really like to ground every presentation in the values of the coalition. These are what really drive our work. This is what we try and imbue in all of our strategies to end homelessness. So the first is that housing is a human right, and that simply means that everyone deserves access to safe housing. The next is that homelessness can be ended. Homelessness doesn't have a long history in this nation. It might feel like it does, but really it's somewhat of a new phenomenon as of the 1980s, and a lot of that was due to disinvestment in public housing and rising cost of housing. that now we see homelessness as this crisis that is fairly new for our country. We believe that through policy changes, homelessness can be ended here. The next is that housing first works. This can be a bit controversial to call out housing first, but all this really means is that everyone is ready for housing. There shouldn't be any preconditions placed on entry into housing. So people don't have to not be using substances. They don't have to engage in services. They're allowed to enter housing and then work on any barriers or goals that they might want to. The next is that ending homelessness fosters equity and justice. There are deep housing policies in this country with deep roots in racism, and we believe that ending homelessness is part of rectifying those, historic wrongs. Solutions to end homelessness should be data-driven. We want to make sure that we are serving the populations who need it most. We're serving folks who are showing up in our response system, and that should be done through real data that we're collecting. And we're going to do a deep dive into data today, so you'll see what I mean by that. And last, and certainly not least, is that lived experience matters. Folks who've experienced homelessness, who've had housing insecurity, are centered at the creation of our policies. The Housing and Homeless Coalition has 2 client advisory boards, one made up of youth who've experienced homelessness and one made up of adults who've experienced homelessness, that act as part of our governance structure, that are at the table involved in creating policies for the homelessness response system. And it's really through their expertise that will create strategies that work for the people who experience homelessness. Now I want to define homelessness. This is a question that comes up a lot of the time because there are many different definitions. Many systems of care have different definitions of homelessness. So I think it's really critical for me to define my terms today. When I say the word homeless today, I am talking about people who fit in one of 3 categories. The first is someone is sleeping in an emergency shelter. That could be a congregate shelter. It could be a hotel motel paid for a nonprofit or a governmental organization, or a warming center, which are temporary pop-up stays. Or it could be someone who is sleeping in a place not meant for human habitation. People are staying in cars, in tents, outside, places that are abandoned buildings, anywhere that isn't meant for folks to stay in. And the last is people who are actively fleeing dating violence, sexual violence, domestic violence, or stalking. Really, that's the category we're looking at today. The other category that, though the coalition does talk about, is not captured as much in our data, is housing vulnerable. And that's someone who's at risk of homelessness. And that could be due to eviction, couch surfing, unfit or unsafe housing, or folks that just don't have the resources to adequately pay for housing. If you see statistics coming out of the school district about students who are experiencing homelessness, a lot of times they'll be in this expanded definition that'll include housing vulnerable. But when we're talking about the homelessness response system, we're really focused on those folks who are what we call literally homeless in this first category. So I mentioned the homelessness response system. So as another tool to define our terms, I just want to talk through about what that means. That is the point of when someone loses their housing, so they're in that housing vulnerability position, they were couch surfing, they were evicted, or their home was declared unfit, any of those scenarios, to the point where they enter an emergency shelter stay, street outreach, or fleeing domestic violence. So the first front door of the system is, how do you get from permanent housing that you've lost into some sort of emergency shelter stay? From that emergency shelter stay, folks are assessed and prioritized to get them back into permanent housing as quickly as possible. So this whole triaging system from the point you lose housing until the point you're rehoused into permanent housing is what we call the homelessness response system. There are many different program types that are working within that system. I'm just going to run through those quickly. The first is street outreach. Those are folks, organizations that are literally going out on the street, offering services and care to folks who are staying outside or in their cars, any unfit or any place not meant for human habitation. They're responding to that. They're trying to convince folks to come into shelter or get them connected with permanent housing if they are willing to go to emergency shelter. The next is emergency shelter. Like I mentioned before, that can be a congregate setting. I think folks might be familiar with some of our congregate settings in Onondaga County, like Rescue Mission, Catholic Charities, and Salvation Army host our big congregate sheltering here. Or it can be hotel motels paid for by a nonprofit or governmental organization. You'll see in our rural counties in Cayuga and Oswego, a lot of the sheltering is done through hotel motel because there is not congregate shelter. The next is transitional housing. That's a little bit longer term, but still a crisis response bed. So that is housing or a temporary stay that's up to 2 years for folks to get back on their feet and then enter permanent housing. The next component is a bit of a in between. It's transitional to rapid rehousing. So that's a combination of folks getting into a short-term stay and then leaving through a housing intervention called rapid rehousing. Rapid rehousing is a subsidy program that can last up to 2 years to help folks obtain a lease in their own name, provide 2 years of subsidy to get them back on their feet through case management services and the duration of that program. Permanent supportive housing is a lifetime subsidy program that is specifically for people with qualifying disabilities. And then other permanent housing is any other permanent housing, any other housing that is subsidized for a lifetime, but that does not have qualifications of disability within it. So, and within all of these projects, these are specific to serving people who are experiencing homelessness. So how does the coalition respond to or oversee this homelessness response system? So we have 5 big buckets of work, I'll call them. The first is the COC program. So Continuum of Care, like I said, is a designation from HUD that provides funding to support 24 projects locally at 11 different organizations. And what that means is we're supporting approximately 1,000 permanent housing beds in this community for people who've experienced homelessness. So we're able to move people from emergency shelter or unsheltered situations and move them into permanent housing. This comes with a national competitive funding process that we're involved in every year and have to apply as a community for these dollars. And that's currently bringing in over $14 million of funding into the community to help support people experiencing homelessness. It is the largest single source of homelessness response funding that exists in this community. The next bucket of our work is the Homeless Management Information System, or HMIS. That is a database that captures all homelessness response projects across the 3 counties, captures their data. We're able to combine all of that data, and we're responsible for submitting a number of reports to the federal government that all get pulled into the annual homelessness assessment report that goes to Congress every year. Our system itself has over 70 projects in it with 400 users and over 60,000 client records. So it's a very large system. all of our member organizations who are providing homelessness response services are capturing all their client information, all of their programmatic data in this database that the staff of the coalition are responsible for in the back end. The next is coordinated entry, and really what coordinated entry does in the homelessness response system at that point of assessment is really looking at how do we determine who gets the small number of beds we have to meet the overwhelming population who needs them. So every person who enters emergency shelter or street outreach that has been there for over 2 weeks is assessed. And assessment questions are based on vulnerabilities. So how negatively impacting is homelessness on your health, your well-being, and really one of the biggest metrics that goes into prioritization is the length of time you've been homeless. And essentially what this does is creates a prioritization list for folks for our housing interventions. So we don't hold standard waiting lists. It's not, the longer you've been there, the more likely you're going, or the longer you've been on the list, the more likely you are to get a housing placement. It really is who is the most vulnerable in the system is who will get the housing placement. The reason coordinated entry has to exist at all, and it is this big comprehensive system, it exists because we don't have enough beds to serve everyone who needs them. We don't have enough housing units, subsidies for all of the folks who need that. So we need a system that's as equitable as possible to determine who's getting those beds. The next is housing services coordination. So this is fairly new to us, but we're looking, and I'll talk a little bit more about this at the end of my presentation, about how do we do community-wide engagement of housing services? How do we better private public partnership with our property owners, property managers, to be able to move our people experiencing homelessness into private apartments. And this has become increasingly more difficult as the housing market has narrowed, and our folks are not necessarily the ones who are going to get screened into a unit when there's a bunch of different people applying for the same unit. So we're looking now into strategies of what can we do to ensure that our folks experiencing homelessness are competitive in the housing market to find rental units. And last but not least, we really do a lot of strategy and advocacy around how do we mobilize the community around ending homelessness, and advocate with local, state, and federal partners on how can we respond to this growing crisis. So part of that strategy oversight is the coalition's 10-year plan to end homelessness. So I just want to touch on some of the strategies that we have developed, or goals we've developed to achieve over the next 10 years. I believe we're 2 years into this plan. So I just talked about the coordinated entry system. The first goal is that our coordinated entry system provides an appropriate housing service within 30 days of entering homelessness. Our current length of stay in shelter the average is 89 days. So we're really far off of this 30 days back to permanent housing goal that we have. So we've got a lot of work to do here, and a lot of that is what is available on the other side for permanent housing options. Our next big strategic goal is that we end homelessness for specific populations. Those include the chronically homeless. So those are folks who have been homeless for a year or more and have a qualifying disability. Those folks tend to be really vulnerable in our system and usually aren't able to move out of the homelessness system without a housing intervention, typically that higher level of care intervention. We have a focus on ending youth homelessness, family homelessness, and veteran homelessness. Our next big strategic goal is to increase the amount of safe, affordable housing stock. And that's both in housing development, but also through policies that allow folks to maintain safe, affordable housing stock. I think affordable housing can get a little bit of a bad rap, but really what we mean is that housing is really just affordable, that folks aren't paying more than 30% of their income towards rent. This doesn't necessarily mean that we need to, obviously, we have a housing shortage and we do need to develop more housing, but we also need to invest in strategies that make the housing that is affordable now or at fair market rent continue to be that way. The next is to eliminate racial disparities in the homelessness system. I'll talk a little bit about this with the data, but there are a lot of disparities, especially in entries into the homelessness response system. And then obviously our big overarching goal is to effectively end homelessness for all populations. So now I'm going to do a little bit of a deep dive into some of our statistics and look at the current state of homelessness in central New York. A lot of this data will have been compiled from our point in time count. For folks not familiar with that, that is a single day snapshot at the homelessness of people experiencing homelessness. So we compile all of the data in our homeless management information system for one day at the end of January. On that same day, we send about 100 volunteers across our 3 counties, canvassing that entire geographic area, literally looking for people experiencing homelessness so that they can be surveyed and hopefully brought in at that time, brought into shelter if that's available. But really, it gives us our most accurate look at the homelessness system. So this is our total homeless population from 2019 to 2025 on any given night. So you'll see prior to 2021, our community was doing a really, really good job at ending homelessness. If you stretched that line prior to 2019, it had been decreasing year over year to these historic lows in 2021. If folks remember, during the COVID-19 pandemic, we did see an eviction moratorium that kept a lot of folks housed who typically would have fallen into the homelessness system. But since then, with housing rises in housing costs, we've really seen quite a dramatic increase in homelessness since 2021. In 2024, there were 1,192 people experiencing homelessness on one night in January. And we had our count in January 29th of this year, and we did see, well, you were the first to see this number. This is an unpublished number, but we are looking at a slight decrease in homelessness this year as compared to last year. It's not significantly significant. I would say that this decrease is about the same number of people as it was last year, but it is nice to see this graph kind of taper off rather than this extreme increase we've been on the past few years. This blue line at the bottom is our unsheltered count. So that is a part of that total number within the green line above. But it's just for folks to take a look at who is outside. I would like folks to keep in mind that this is January in central New York. So most of our folks are in shelter on the night of the point in time count. We do see these numbers increase during warmer weathers across this bottom blue line, but we are required by HUD to do this count in January. So we do see lower numbers, but overall, it is always our sheltered numbers are higher than our folks who are sleeping outside. We have one of the best response systems in terms of getting folks into emergency shelter. And it's not just because of our climate here. A lot of our neighboring cities have trouble with large-scale encampments. that we just don't have, and that's because of our shelter response system. We have low barrier shelters that are responsive to taking folks in. We have great street outreach teams that are convincing folks that they'd rather be in shelter with supportive services than out on the streets. So I just think our unsheltered numbers really demonstrate something we do very well in this community. So I did mention that we cover 3 counties. This top graph here is just a look at how the total population breaks down between the 3 counties. So the largest population, around 50% of that total number, are in Onondaga County. Cayuga County has about 24%, and Oswego County has about 26% of the total population. Underneath that is that total number, that 1192, broken down by race and ethnicity. So you can see a majority of folks experiencing homelessness are white. However, there are about 40% of people experiencing homelessness that are Black African American, or Black African American, as compared to the total population through the census in the 3 counties. Black African American households account for 8.5% of the population. When you compare that to Black African American households accounting for 40% of that population, you can see how bad of a disparity there is in the response system, and that's folks who are losing their housing and finding themselves in this emergency situation. Another part of the point in time count, is looking at subpopulations, and I apologize, we haven't gotten through our 2025 numbers yet, but one of the things I want to point out here, so our orange line here is our adult only households, so those are households with no children, and our blue line at the top here are adult and child households, so families with minor children in the home. And you can see prior to really 2023, our family homelessness had been pretty consistently lower than our adult-only households. We were really seeing overwhelming numbers of single individuals experiencing homelessness. And you can see those numbers haven't really changed in adult-only households from 2019 to 2024. It's our family numbers that have increased so significantly since 2021. And in this point where families outnumber single individuals, that is the first time that has happened since we started doing this count in 2009, that people and families have outnumbered single individuals in shelter. At the bottom here are chronically homeless, so that has remained pretty low across the years. And then our veteran homelessness is the yellow line there. So we are maintaining low numbers of veteran homelessness. There's been a lot of investment into housing for veterans, both rapid rehousing and permanent housing for veterans, which has worked, and I think that's demonstrative of what a homelessness response system needs, that we're able to maintain those low numbers. So to touch back on the family homelessness a little bit, I wanted to do a comparison of family homelessness, which is the green bars here, versus the amount 3-bedroom fair market rent. So as you can see, family homelessness has risen since 2020, and so has the cost of an apartment. Our FMR for 3 bedrooms has gone up significantly since 2020. With rising housing costs comes more families not able to afford housing. And really, that's what homelessness is. It is a housing problem. There are many factors of why someone might experiencing homelessness, but the number one factor why everyone is experiencing homelessness is lack of housing that they can afford. Next, I just want to touch on youth homelessness a little bit. So we break out youth homelessness into 3 categories: youth that are under 18, youth that are 18 to 24, and then parenting youth, so that's youth with children. And we've seen, again, rising numbers of most youth categories, especially in that 18 to 24. Youth are an incredibly vulnerable population in the homelessness response system. In some of our rural counties, there's not enough services to support youth. And these are really young people who might have never held a lease in their name before, who might not have living skills or had to live without their parents. So really, we want to make sure we're keeping an eye on youth homelessness, and I'll talk a little bit about those strategies in a minute. So the other part of the point in time count is the housing inventory count. So we're really looking at the beds that are available to the people in the homelessness response system. So you can see we've actually increased in a lot of our housing categories. Our transitional housing beds went up. Our rapid rehousing beds went up from 23 to 24. Our other permanent housing beds went up from 23 to 24. That's in large part due to some state investment into supportive housing, known as the Empire State Supportive Housing Initiative. So we have seen more capacity in the homelessness response system. However, it's still not keeping up with the need for everyone who does need that response. I do have a caveat. As you can see, the emergency shelter numbers have jumped up. This does not mean that more congregate sheltering has been created in the community. This is just showing that counties are responsible for housing folks who are experiencing homelessness, so they will expand shelter services through hotel motel placements as needed in response. So there haven't been, large scale increases of congregate sheltering. It's just responding to that rising number of people experiencing homelessness. So this is a somewhat complex look at the homelessness response system, or the pathways of the response system. And I just wanted folks to look at this. This is annual data rather than that point in time count data. But I really think it demonstrates how folks move through the system. So I'll just walk people through it quickly. So the 4,000 plus households that entered the system, 92% of those folks went to emergency shelter. Some folks went to other pathways. Some folks were unsheltered and went through street outreach. Some folks went straight, 3% went straight to transitional housing. And then from the homelessness point, so when they're entering emergency shelter, 11% of folks went to rapid rehousing. And that's that middle intervention. So folks might not be high need, they might not need lifetime subsidy. About 11% of folks moved that way. Only 4% of people experiencing homelessness went to the pathway of permanent supportive housing. So that's that really high need. Folks who have a qualifying disability, who've been homeless for a significant amount of time, found themselves tracked for permanent supportive housing. 82% of folks who entered the homelessness response system left with no intervention. And that really just goes to show how little capacity there is to serve everyone within this system. And you can tell that for the folks who are within an intervention, their rates of permanent destinations are higher. So you'll see that folks who didn't have any intervention, only 17% of them exited to permanent housing destinations. So main takeaways I'd like you to take with you. Overall homelessness has increased 63% since 2019 and over 150% since those historic lows we saw in 2021. For the first time in recent history, again, the number of people in families is higher than single individuals. Family homelessness has increased 192% since 2019. Only 4.5 of people experiencing homelessness on the night of the count were unsheltered. Onondaga County continues to have the highest percent of the continuum of care's homelessness population, but increases in homelessness is not isolated to Onondaga County. It's not isolated to the city of Syracuse. Every part of this community, 3-county region, has seen increases in homelessness. Black African American households are disproportionately represented in shelter. Like I mentioned, they make up 40% of folks who are in shelter and only 8.5 of the 3-county census. And despite that increase in permanent housing beds available, the growth of folks entering the homelessness system is not meeting the needs of people experiencing homelessness. So some policy recommendations. We really need to right-size congregate and non-congregate shelter options for people experiencing homelessness, making sure our shelters are low barrier, accessible to the people who need them. We need to encourage affordable housing development that is responsive to community needs. That also includes policy changes that allow folks to keep their homes. We need to centralize property owner engagement and partnership. So something we're looking at this year is as the coalition, are setting up a Zillow-esque platform for people in the homelessness response system to use to identify affordable units and property owners willing to work with our population. We need to invest in homelessness prevention and upstream causes of homelessness. We really don't do a good job of preventing people from experiencing homelessness on a funding level. It's one of the least funded parts of the homelessness response system. 60% or 70% of the people who enter homelessness are doing it for the first time. So these aren't folks who are continuously cycling through this system. They're really folks who've never experienced homelessness before and just couldn't make ends meet and found themselves homeless. So we really need to create interventions that'll keep people housed. We need to maintain federal homeless assistance grants that fund our critical housing that we do have. This is extremely at risk right now as we work through changes in federal policy and priorities. We need to maintain the mechanisms that we have to house people. And then we'd love to see universal voucher programming at the state and or federal level. We feel much more confident in the state to pass that. And that's anyone who's eligible income-wise for a subsidy or housing voucher would be able to access one. So with here, I'll wrap up and I believe we'll open for questions.
Thank you, Megan. Wow, a lot of information and excellent presentation. So thank you so much. We're going to bring Brian Hoke into the picture here. Brian's going to lead us in a little bit of moderating the questions and answers. So go for it, Brian.
Thanks, Rita. And thanks, Megan, for that thorough, well-crafted, but sobering presentation. We had quite a few questions submitted in advance. We probably won't be able to get to any that you all who are here submit in the Q&A or chat. If we can, we will, but it's probably unlikely, but thanks to everybody who submitted questions. I guess first, we had quite a few questions about, causes and what's being done, right? And you addressed those thoroughly. Uh, some of the things that stood out for me was the correlation between lack of affordable housing, the rise in the cost of, say, fair market rent and homelessness, and your statement on the last slide there about not addressing the upstream causes. I'm curious if I can sort of summarize a bunch of those questions we received. Is it more supply than demand, or lack of, right? Is it obviously it's a complex issue, and there is poverty and education and transportation and other challenges, substance abuse and mental health. On the other side, there is the ability simply to pay for something that costs more and more. I guess I'm asking a question that I suppose is not so simple to answer, but is it more of those two sort of sides of the equation? Has the lack of the cost of housing going up been much more significant than the other factors, given that we've seen this rise in the challenges recently? Apologies if I'm not expressing that well, but I wonder if you might speak to that in addition to what you already said.
Yeah, I think that's a great question. And I think what you could really, and what I maybe didn't say, is housing costs have risen over 30% here in the past few years,
Wow.
just locally in this
Mhm.
area. And really, prior to this rise in the cost of housing, we were decreasing homelessness, and we had those same challenges that you mentioned, Brian. There was substance use, there was mental health. Some of these might have increased in the past years, but they still existed as part of
Mhm.
the homelessness landscape. Folks were in poverty prior to COVID-19, prior to this increase in housing. So really the factor that has changed for us is the cost of housing. That is what's delaying folks to be in shelter longer, is that it's harder and harder to find appropriate housing to rehouse folks in. We're seeing families lose housing that they might have maintained for years because now that the market has changed, property owners want to get more money for a property that they could get more money for now, and there's really no protections for folks from that. So really for us, that has been the big shift
Mhm.
into that system we were already working in and seeing some good results in previously.
Yeah, I mean, your data certainly bear that out. Um, we had quite a few questions related to that on differences, perhaps, between the city of Syracuse and the suburbs, or different counties. I imagine those challenges, though they might have subtle differences in gross terms, have those rises in costs been the same and had the same effect in rural areas, say, as opposed from the city of Syracuse, or suburban areas? Are there marked differences in how that trend has happened in different sort of demographic, geographic areas?
Yeah, I think what's interesting, and I've told this story before, but the point in time count last year. So we send volunteers over our three counties. There's about 100 volunteers going out, and all the years leading up to that, most teams would come back from the geographic areas and say, "Oh, we didn't find anyone. We didn't find anyone." And it's like, "Oh, good. That's a good thing.
Great, right?
Like,
Yeah, right.
thanks for driving
Yeah,
around in the middle of the
yeah.
night. We appreciate it." Um, Last year, we're sitting there, and almost every team that went out found someone sleeping unsheltered. Fayetteville,
Wow.
DeWitt, Camillus, Nedrow, every team across our community found folks who were sleeping outside. And what that says to me is, in these communities that maybe hadn't experienced it or hadn't had people really living on that edge of facing homelessness are now
Mhm.
doing so. And I think what you find is people who are experiencing homelessness, especially in suburban and rural areas, if that's where they want to live, the capacity of where they can rent is so limited. So you have to ask folks to leave neighborhoods they probably have lived in their entire lives to find affordable housing. So really that capacity is so narrow in those communities that it almost deprives people of the choice of where they want to live.
Hmm. Wow. We had a question. Thank you for that answer. We had a question from Lisa asking about is there new information on federal cuts to HUD or other agencies that is worrisome? I mean, obviously you have no crystal ball, right? The cuts are what they are or what they might be, but do you are there things on your radar that you're looking at in particular that are worrisome or conversely hopeful?
Yeah, I mean, it's been quite a an interesting few months trying to navigate this landscape that has changed. We had seen more investment prior to this administration in the continuum of care into our programming. And we now know that there's going to be a cut in the continuing resolution to the continuum of care program. It's not as significant, I think, as we feared. But again, that only gets us through the end of next year. So we really are nervous that, the federal government, they support the largest homelessness response permanent housing grant this community has.
Really?
And we do anticipate that, there's cuts slated for next year. We're also concerned about the reframing of how we're doing that work. And,
Mhm.
some of those values that we've really put into this work may shift alongside of funding cuts.
Got it. And you mentioned that the state under the current administration had stepped up some of it, but it sounds like that is a smaller part of a smaller piece of the answer, perhaps. In that, am I reading that correct?
Yeah, the state has made some great investments into development of supportive housing. So in
Hmm.
the past, I think we're on year 7 of the Empire State Supportive Housing Initiative was a huge initiative to develop more actual units with supportive housing into it. But we're nowhere near scratching the surface of the need in the community already with the resources we have. I don't think, the state could, even if it wanted to replace across the entire state, what we would lose in federal cuts.
Hmm.
So it is it's a big nut that's going to be cracked at some point. Hopefully, maybe not, but we do have some challenges ahead.
Gotcha. We had a few questions about what people can do to help and what organizations are helping, and you share that the wide variety, and that is heartening, I think, to hopefully most of us. That lots of hands pulling on oars. I'm curious about, in addition to just the shelters, and some of our questions sort of uh, hinted at this. What else helps, right? So job training, the things that are not, boy, this person's outside, right? First, we got to get this person in 5 below weather out of the off the street and into. But thinking longer term, I imagine there are lots of even the prime agencies, but some other ones too, who do job training and ESL work and what have you. Curious if you could speak a little bit about the less direct services that your member organizations provide and how it contributes to the solution.
Yeah, so within the response system, we really focus on that permanent housing placement as the first step. So
And as it should be, right? I mean, yeah,
yeah, you can't get a job if you don't know where you're going to sleep at night. They
right,
can't mail
right,
your offer letter anywhere.
right.
It just makes things more challenging. But I think what's great is on the back end, once folks are housed, we are getting those connections into employment services, into mental health or healthcare services. A lot of our organizations have health home care management, or they're connecting with healthcare providers to get folks set up with that. They do, a lot of agencies have volunteer or work opportunities for people who've experienced homelessness, which is amazing.
Mhm.
We very much encourage our organizations to hire folks who've experienced homelessness on their staff, and a lot of them have done that. And really, what we allow is the person who is experiencing homelessness or has been recently housed to dictate what that looks like for them, to dictate that service. And it's really on our organizations then to make sure that service provision happens and that what they say they need, they're getting. So there is a ton of great work being done. We've had our organizations work through legal issues, through even something as simple as getting your pet fostered. So when you are housed, you can have your pet back. You know, anything that the person says, this is what's very important for me, this is what'll help keep me stably housed, is really what's going to be offered.
Gotcha. We're just about out of time, but I did want to bring up Virginia, my friend Ginny, with whom I've volunteered for years, asked if anyone has seen the exhibit at Art Rage regarding homelessness in Syracuse. I have not and didn't even know about it, but we'll check it out. I'm curious if you knew about it or had anything to share.
Yeah, I did know about it. I hear it's wonderful. I haven't been myself yet, but I was
Well,
supposed to go and wasn't able to make it. But I hear
gotcha.
it's amazing and highlights a lot of the good work being done.
Cool. Well, I'll check it out. Well, thank you very much for the presentation. Great to learn about. Sad that there are these challenges, but at the same time, appreciate everything you do. Rita, I'll turn it back over to you.
Okay, thank you so much. Megan, it's been a wonderful presentation, very informative. So we're very thankful that you were able to do this for us. So thank you. People had asked there, we are going to be sharing your PowerPoint. So that I think is going to be on our website along with the video, because we did videotape this, and that will be on our website along with all the other videos that we have of our focus forums. Thank you everyone for being here today. If this was of interest to you, and you would like to contribute to the cost of there's an easy way to donate funds to Focus at focussyracuse.org. Again, thank you, Megan. Thank you, Brian. And everyone have a wonderful day and a weekend. Thank you.